Hey, welcome. My name's Dr. O, and today I'm going to be answering a question that's posed to us a lot. I have a lot of patients who have seen a pediatric dentist for their entire childhood, and then they come and they ask me, when should my child move or graduate from the pediatric dentist and start seeing a general dentist? Well, a lot of doctors vary in this answer, but I have my personal view on this is that if you look at the hygiene of children, as they get into their teens, it's not that good, or it's a little bit more challenging, to be more politically correct. But my take is that if you take your child to a pediatric dentist, by the time they hit 12 and they get all their adult teeth in, they're probably ready to see a hygienist for their future cleanings. Not saying that at a pediatric office you don't get a really good cleaning, but a lot of times the cleaning's done by using a dental assistant's using a little prophy wheel, and then the doctor will come in and scrape some tartar off. But if you think about yourself as an adult, we go and we see a specialist for our cleanings, and that specialist, is a hygienist. And so I like to always tell parents that it's always great to have a hygienist take care of your children's teeth or clean their teeth while they're in orthodontic treatment. And so my ideal time is before where the children start to get their adult teeth. So that typically happens around the age of 11 or 12. And so my recommendation is that, if you have a child who's the left tackle of their football team and he's 6'5", and he's going to the pediatric dentist when he's 15, 16, or 17, and he's 6'5" and he's trying to fit into a 5-foot chair, it's probably time to move on. But having a great relationship with your pediatric dentist is important, but I also think it's really important to kind of graduate and start fulfilling on the needs of your child by getting them to see a hygienist when they have their adult teeth in. And again, there's that transitional period between 7 and 12, between when kids have some adult teeth and some baby teeth. You're just going to have to make a determination of how well your child is doing with keeping their teeth clean. But again, having seen so many kids go through orthodontic treatment, I always think that by the time they get their adult teeth and they're starting braces, they really want to be working with a hygienist. So if your pediatric dentist employs a hygienist, great. If they don't, then you might want to consider the needs of your child might supersede keeping them in the pediatric office. It's a tough thing to say, but I don't go to if I need a root canal, I'll probably go to a specialist and see an endodontist, or if I need to have my wisdom teeth, I'll get an oral surgeon. So I like to have that specialty, people who are really geared to, and their passion is to take care of that certain problem. And so when it comes to hygiene, I really prefer to have a hygienist take care and clean your teeth. So hopefully this answers that question, and